Complications with ovarian cysts. Ovarian torsion, cysts can grow so big that they distort the shape of your ovary, increasing the chance of painful twisting of the ovary. Ovarian torsion. The blood supply to the ovaries can reduce or stop, means that ovary is no longer getting enough blood. When this happens, it causes sudden, extreme pelvic pain, nausea and vomiting. Cyst rupture. The ruptured ovarian cyst might vary based on its type. The larger the cyst, the greater the risk of rupture or burst. Ruptured cyst causes sudden and severe abdominal pain. Vigorous activity that affects the pelvis, such as vaginal sex, also increases the risk of rupture. In case of rupturing of the hemorrhagic ovarian cyst, a type of ovarian cyst that is filled with blood, it can cause the blood to leak into surrounding tissues, and this condition often requires immediate medical attention. Cancerous cyst. Ovarian cysts after menopause are more likely to be malignant, cancerous. Very occasionally, an ovarian cyst can be an early form of ovarian cancer. Ovarian Cyst Diagnoses. A cyst on ovary can be found during a pelvic exam or on an imaging test, such as a pelvic ultrasound. Depending on the size of the cyst and whether it's filled with fluid or solid, doctor likely will recommend tests to determine its type and whether you need treatment. Possible tests include pelvic ultrasound. Sound waves make an image of uterus and ovaries. An ultrasound scan can confirm an ovarian cyst. It is used to confirm cyst's location, size, shape and whether it's solid or liquid, filled with fluid. It creates an image of uterus and ovaries on screen. Laparoscopy is normally performed in an operating room. A slim instrument with a light and a camera, laparoscope, is inserted through an incision, small cut, into abdomen and their ovaries, and any type of cyst can be seen or viewed. Blood test, called a CA-125, cancer antigen test, is done along with ultrasound. Cells produce a protein called CA-125 on their surface, which then releases into the bloodstream. This test measures the amount of the protein CA-125, cancer antigen 125, in the blood. Women with ovarian cancer tend to have higher levels of this protein. Pregnancy test, to rule out pregnancy as the cause of the cyst. Corpus luteum cysts are normal to see during pregnancy. Other tests. Some women may have other tests like computerized tomography, CT, scan or magnetic resonance imaging, MRI, etc. Ovarian cyst treatment. The treatment for ovarian cysts depends on several things. This includes age, whether having periods, the size of the cyst, its appearance and symptoms, and what causes cysts. Watchful waiting. Functional cysts normally shrink on their own over time, usually in about 1 to 3 months. If you have a functional cyst, your doctor may want to check you again in 1 to 3 months to check on the status of the cyst. If you have no symptoms and an ultrasound shows you have a small, fluid-filled cyst, you may have several follow-up pelvic ultrasounds to see if your cyst changes in size or appearance. Ovarian cyst medications. If you develop functional cysts often, your doctor may want you to take birth control pills or other hormonal birth control so you won't ovulate. If you don't ovulate, you won't form functional cysts. Birth control pills will not shrink an existing cyst. Ovarian cyst surgery. If a cyst is causing symptoms and getting bigger, you may need surgery to remove it. The type of surgery depends on the size of the cyst and how it appears on the ultrasound. The different procedures used include laparoscopy. If cyst is small and if it looks benign, then doctor may decide laparoscopy. This is a procedure where doctor inserts a small camera through small incision, cut, in abdomen. With the help of laparoscope, doctor can see organs and pelvic cavity. The ovarian cyst can be removed through small incision at the pubic hairline, ovarian cystectomy. In some cases, the ovary with the cyst is removed, oophorectomy. Laparotomy. If the cyst is too large or if there are other concerns, then doctor will go for laparotomy. This type of surgery there is bigger cut to remove cyst. The cyst is then tested for cancer. If it is cancerous, you may need to have the ovary and other tissues removed. This could include the fallopian tubes, the other ovary, or the uterus. An ovarian cyst that develops after menopause is sometimes cancer. In this case, you may need to see a gynecologic cancer specialist. You might need surgery to remove your uterus, cervix, fallopian tubes and ovaries. You may also need chemotherapy or radiation.